So the impact right now with COVID-19 outbreak for us is to continue our operations to serve the public. So we have stepped up our response with some modifications to protect ourselves and also the public from any spread of the virus. So right now we're still providing all the services, emergency services that we've always provided, but we've made a few changes. For instance, our offices are closed except by appointment to limit the amount of people in the office space. We have modified some of our training schedules to limit the amount of indoor group participation kind of classes that we do. So we're trying to keep our employees doing the social distancing ideas. We do have 6 stations, so right now we're keeping those personnel in their individual stations rather than trying to gather them for different processes and events. We've canceled all of our tours for the general public. We have canceled EMS student ride-along program and other things that would have us interacting with the public. So we are suspending our business inspection program except where it's absolutely needed to limit the amount of our personnel out into the businesses and other stores and things like that at this time. So it's operations as normal with added precautions. So obviously we're still responding to people for EMS calls, fire responses, etc. We have extra precautions. Basically, we've just reiterated with our personnel, take the same precautions that we always take, but make sure that you're doing all the procedures. So we have protective clothing in place for responders. It's in relatively limited supply right now across the country. So we're we have plans in place to conserve that and only use it when we absolutely need to, based on the patient condition and things like that. So we have modified some of our response based on that, but we're still running to all the calls, still answering all the EMS responses, just taking added precautions with protective clothing based on the guidelines we're getting from the CDC, the Iowa Department of Public Health, and other sources, kind of doing best practices. So we work with the city public health and the county public health departments who are leading the efforts against the spread of the virus, and we take direction from them. And then also, like I said, the Iowa Department of Public Health, who they report to, and the CDC. There's quite a bit of guidance out as far as emergency responders and other healthcare workers. We pretty much are taking the same precautions that other healthcare is taking as far as protective clothing. We do have orders out right now as far as extra cleaning in the fire station, sanitizing, things like that, doing all the things most businesses are doing, asking our employees to stay home if they're sick, report to us if they are, self-monitor as it's appropriate based on the guidance and things like that.